Good afternoon, everybody. This is Sassy Nyman with Illinois Action for Children, and we are just letting folks join on to the call, so we're just going to get started in a minute or two. Okay, good afternoon, and welcome to our State Policy Priorities webinar, the first of the legislative season, and with most likely at least a couple, if not many more to come. Our goal here at Illinois Action for Children is to make sure that our members, our statewide advocates, the field of early care and education professionals are well informed and well connected to what's happening in Springfield that affect both children and families, many of them are in your care, but also affect you as a workforce and as you as a professional field in terms of child care providers, community-based across the state, child care resource referral agencies, and other support services, early intervention, home visiting, and the other programs that we know vulnerable children rely on to succeed. So, like I said, this is our first in the season. It is early. We have a legislative session that's been convened officially for a couple of weeks, but has really only been in Springfield 2 days, for including yesterday's State of the State address. So this is a preview of a bit of a recap and a preview. And at the end, we're going to tell you some other dates in terms to hopefully to put on your calendars as information and things start to develop in Springfield. We want to make sure that you are kept abreast of them because we know that change happens through many voices, not just one, and that the power of Illinois Action for Children is really based and found in our community-based providers, parents, and families that work with us and have a strong advocacy voice. So I'm going to just start with yesterday's address. So the governor had his second State of the State address. It is being lauded across the state as being much more conciliatory, much more collaborative in his tone than his first one a year ago, and definitely much more than some of the remarks and comments that have come from the administration since the holidays. And so in that respect, it was great. We think that, and we believe that a solution is only possible with the General Assembly and the administration working together to really think through the very serious challenges that face our state. So we're going to focus really this conversation on state policy. That's not to say that everything that we do in state policy is not impacted by what's happening at the federal level. We'll make a reference to some federal pieces that are immediate, but also tell you of a date in February where we're going to spend a specific and allotted amount of time to talk about the federal policy issues and budgetary issues that definitely will and does affect us here in Illinois. So the State of the State, Governor Rauner said a key to a higher quality of life is a fully integrated education system for early education, from early education onward. We absolutely agree with the administration on this. Unfortunately, there was very little talk in yesterday's State of the State. There is yet to come a State of the Budget, so we understand this was not designed to be a budget address. But the State of the State is that we don't have a budget. And so there was very little to no mention of the fact that we are 7 months into our fiscal year and still do not have a fiscal year 16 budget. So the things he talked about in terms of education, he has said from the very beginning, from the campaign days, that he is absolutely committed to education. He made it a big part of his speech yesterday. We appreciate that. He really talked about supporting a P through 12 education system. Thumbs up on that. We always want to talk about a P through 12 as opposed to a K through 12 system. And that we need to provide adequate funding to strengthen our early childhood as part of growing that larger system for student success. That we want to increase the quality of our early childhood infrastructure. Again, could not agree more. He called for more supports for low-income and rural children and students. Absolutely. They are, by geographic or poverty, marginalized in their communities and in our state, and so we need to make a conscious effort of making sure that they receive the services that they need to succeed. He talked about fully integrating a human services system for young people and to really think about a cradle to career. We have a P20 council that has talked about and been framed as a cradle to career group of folks to think through what children and families need. So again, we agree. And in fact, the governor yesterday announced the creation of a cabinet on children and youth. We don't know what that means. We don't know, is that in addition to what already exists? Is it in place of something that he proposes will go away? We don't know, and that is something that we presume more information will be forthcoming. So again, all of this, the right points, nothing that we philosophically disagree with in terms of education and education system, but again, there was no mention of an FY16 budget impasse, other than to say that the turnaround agenda items that he clearly articulated in terms of the things that he's still committed to needs to be addressed before we have a budget. We believe that a budget is and should be the #1 priority. So we'll move to the next slide. In terms of kind of coming back to Illinois Action for Children, so what we try and do is we look at the year ahead, understanding the context of our state's economy, the political environment, but most importantly, what is it that we see and hear from all of you and from the children and families that rely on services? What is it they really need, and what is it that Illinois Action for Children can do, and how should we organize our efforts in order to move the needle for children and families? So first and foremost, we think the priority is an FY16 budget. I think we've said that all along, and again, we're in the 7th month without one. Restoring access to the Child Care Assistance Program. Clearly, we are not as bad off as we were July 1st, but we still have some room to improve based on the severe cuts that we experienced in the beginning of the fiscal year, and we'll talk a little bit about that just to recap what those were again and where we stand. Improving child care program quality. That we have a quality infrastructure that we have dedicated ourselves to building and growing with limited resources, but have created a good infrastructure, and I think that we need to focus on continuing to both defend that, but also to improve program quality in all settings for young children. Thinking about the early childhood block grant part of our early childhood system, we are still way behind where we were over 8 years ago in terms of our funding and number of children served, and so we are still working towards the restoration of the early childhood block grant to at least 09 levels and maybe even go beyond that, and so we are looking to increase funding for the block grant. Equitable and adequate P through 12 funding. So we increasingly want to, as the governor made reference to, be really part of a larger education conversation, and so to do that, we know that providers, we can have a high quality early childhood system, but if we send them off to a K through 12 or a K through 8 school that is lacking in resources, that does not have equitable funding, does not provide the supports that particularly low-income, marginalized, and rural families need to thrive, then we're really not serving the children. And so we need to consciously be thinking about a P through 12 system and not just a K through 12 or a birth to 5. Foundational to all of this is a fair and adequate revenue stream and system. We have an antiquated revenue system in Illinois that is based on a manufacturing industry that has all but dried up or gone offshore. We have an agricultural system that is significantly diminished from when our tax base was created many moons ago. And so we need to, as we have said for many years, review and overhaul our revenue system to really think about how we tax people and businesses and resources in this state. And we also need to make sure that it is adequate based on what we know Illinois citizens need to thrive. And always thinking about childcare is not a panacea. It does not cure all ills that come to children, and so we always want to be thinking about the broader context of children's health and safety. Under that, we would think about the licensing standards that guide childcare programs. We want to think about health, access to all types of health care and finding health homes for young children and their families, as well as things like children's product safety, which we have worked on for many years. So that's an overview of our state policy priorities. Those are broad and vague, and as we go through the session and as bills are introduced, there will be, I'm sure, bills that will populate under each one of those headers. But this is the framework that guides us as we go into this session, and we try and make sure that we focus on these priorities because we think they're the ones that matter the most. So if we go to the next slide and start to dig deeper a little bit into some of these issues. So this FY16 state budget. We are at what everybody would pretty much call an impasse. It's not, doesn't look like it's going to get better anytime soon. People ask me all the time, so when do you think we'll have a budget? And I wish I knew. But I'm not hopeful that it will happen in the month of January. I'm not hopeful that it will happen in the month of March. I suspect that we will go through the better part of this session negotiating both an FY16 and as closer we get to the end of May, also negotiating an FY17 budget. But that's just my guess from where I stand today. On February 17th, we will hear the budget address from the governor, and hopefully we'll get a better sense then. But we are at an impasse. That being said, the state is actually spending about 90% of the budget as if we think about the FY15 budget in terms of what that amount of money was, and going on that, which because we have nothing else to go on, we're spending about 90% of that budget already, even though we officially don't have a budget for this fiscal year. That has happened through court decrees. It has happened through court order, or consent decrees, court orders, and legislation that has been passed by the General Assembly to force things like the pass-through of federal funding. There's a bill being entertained today for payment of math grants for higher education. So there are a number of things where the General Assembly has taken actions to say you have to release this money because these things need to be paid, or everything else will suffer and stop. So what we know is there's about $2 billion in human services that are not covered by any of these consent decrees, court orders, or legislation, and there's about $2 billion in, again, higher education. That could be addressed today with a bill that's being entertained as it relates to MAP grants, those grants to higher education students who are low income and qualify for assistance. So our request at this point in time is to pass an adequately funded FY16 budget to move us through this impasse. So if we go to restoring access to child care. So just to recap or to remind all of us, even though I'm sure you work every day to forget the hardships that we subjected parents and families and providers to for the better part of the summer and fall, is that we had a major rule changes take effect July 1st that were implemented by the governor, or announced by the governor and implemented by the Department of Human Services, that drastically cut child care eligibility back to 50% of federal poverty for any new applicants into the system. You all worked incredibly hard, told your stories, made your voices heard, and really created a full court press, and finally moved the governor to compromise with the legislators who were championing this issue in Springfield through legislation and other means. And on November 9th, the governor did amend his emergency rule to partially restore the child care eligibility back up to 162% of federal poverty, not the full 185, but it came pretty close. What we know based on the last data that we received, that's been quite a while, but we estimate that there's still about 10,000 families with incomes between 162 and 185% of federal poverty that are still not eligible for child care, and there's about 5,000 full-time students that are not still eligible for child care because of the way that the rule was put into place on November 9th. So again, our request for this is to restore the child care assistance program to June 30th, 2015 levels. That's not just the income eligibility. Again, it is addressing this issue of full-time students in post-secondary education. So those families are working and doing the right thing to move up the economic ladder and towards stability, and yet we are doing everything we can to keep them down. So we need to address that. And a restoration to June 30th levels is a good place to start. We always talk about child care access and quality in the same sentence. We've chosen to separate them out here in terms of separate slides because they are both of them are so important, and we really do have to be conscious that fixing one does not fix the other, and that one cannot be fixed at the expense of the other. And so we want to make sure that we're talking about them always tied together, and to be very intentional about eligibility is not quality. But at the end of the day, if we have high quality but nobody can access, who are we helping at the end of the day? And so we've separated out to say that we really do have a quality infrastructure that we need to maintain and to continue to grow in order to get the outcomes that we want for young children and families, and to make sure that they reach their full potential in learning and in life. So we've been a national leader. I go to national meetings. I was at one just recently. My colleague Chu was at one today. We've been a national leader in terms of how we support low-income families through our child care assistance program. That is in jeopardy if we start to dismantle the quality infrastructure that we have. That includes both the system of professional development and supports that we have for our teachers and directors. It includes our Accelerate system. It includes all the things that we do that build and incent and reward and help us pay for quality, which we know costs more. We are in an environment where we have in 2014, the Congress actually for the first time ever reauthorized the Child Care and Development Block Grant, and there were a couple of really goals with that reauthorization, and one of them was at the state level for quality improvement. The other one was to streamline services for families, and so those rules need to be implemented in the coming fiscal year. So most of them will start in September of this year, 16. So our state federal fiscal year 17. And so we'll be looking to what the state's recommendations are in terms of implementation, and hopefully really see how we're using those federal guidelines and those new rules to inform and bolster our quality infrastructure. And there's some advocacy related to that we'll get to later. But these new CCDBG rules are not public yet, and so we're waiting to see what they are. But we definitely need to kind of think about them as an opportunity for us to embed and grow the quality infrastructure that we already have in Illinois. So our request here is to protect and maintain the quality improvement infrastructure, and then to really implement the CCDBG standards in a way that we know will do the first stop point, which is to really protect and maintain quality. So when we move to the kind of second leg of our three-legged stool that we always talk about in early care and education, those three legs of the stool are child care, pre-K, and Head Start. So the second leg is the Early Childhood Block Grant in Illinois that funds our state-funded pre-K program. We were a national leader, are still one of the only, I think the only state that has a state-funded pre-K program for 3- and 4-year-olds, and is a birth to 5 system in terms of that our Early Childhood Block Grant funds not just pre-K services, but also birth to 3 home visiting services. And so when we think about the Early Childhood Block Grant funding, we always want to make sure that we're thinking about the birth to 5 continuum, because for every dollar that we spend on pre-K services, we know that we have a mandatory set-aside that supports infants and toddlers in home visiting programs. So all good things, all things that we need to work to protect and to grow. So in FY09 through FY15, the Early Childhood Block Grant was cut by $80 million. In FY16, so this past legislative session, so this time a year ago, we started advocating for an increase in the block grant to start to restore those cuts, but also the fact that Illinois is a preschool development grant state. And we have a commitment as part of that partnership with the Department of Education at the federal level that the feds put in some money, but we also have to put in some money at the state level in terms of our general revenue sources to reach a broader audience in terms with our pre-K program, and to also deepen those services in those highest needs communities. And so we had last year gone to the legislature for a $25 million increase, no, for a $50 million increase. We fell short of that and came home with an increase of $20 million. A reminder, the education budget is the only budget, I think it's, no, maybe one of very few budgets that the governor actually signed. So we do have an education budget in the state of Illinois, and in that budget is a $20 million restoration of funds for the Early Childhood Block Grant. Far from the $80 million that we've been cut, far from the $50 million that we've been requesting in order to meet our federal obligations for the Preschool Development Grant, and so we have to go back at it. So we still serve nearly 19,000 fewer 3- and 4-year-olds than we did in 2009. So we're still falling far short in terms of the number of kids that we did serve, and we know that there are new babies born every day, and new 2-year-olds become 3-year-olds, and 3-year-olds become 4-year-olds, and we know that those windows are short, but the impact is great. So our request this year is to increase funding for the Early Childhood Block Grant by at least $75 million, because again, we have another year's commitment to match our federal investment for the Preschool Development Grant of $50 million, and we have to make up for what was not included in last year's budget, which is that full 50. And so this year our request is a minimum of $75 million investment in the Early Childhood Block Grant, and this would restore the program to its FY09 funds levels, as well as meet the federal requirement of our state match. So the Early Childhood Block Grant is part of our State Board of Education. It is part of our overall education budget, and so it is, at the end of the day, part of a P through 12 system. It is part of a P through 12 funding structure, even though it is carved out in terms of early childhood, is not part of our funding formula for K through 12, which I think serves us well in Illinois. But we increasingly need to think about and talk about a P through 12 funding. So Illinois ranks 49th in equity and 50th in adequacy. Ouch. So last week I was in Finland, because my mom lives in Finland, and it was cold and dark, but it was here too, so that's okay. And Finland, up until this year, where they fell to number 2, is number 1 in the international PISA scores, which is the kind of creme de la, it's like the Oscars of education. And I love the story that Finland tells, that they got to be the best not because they set out to be the best, but they set out in search of equity. That they wanted to make sure that they had the most equitable education system so that all the kids, regardless of where they lived in the country and what their circumstances were, that they were getting the exact same thing that other kids were getting. And so through the search for equity, they reached excellence. And so we need to think always about equity in our education system. And so the fact that Illinois ranks 49th in equity and 50th in adequacy, we have a long road to hoe, people. Students have a variety of educational needs that must be met. And so when we think about equity, we always have to remember, and this is true in birth to 5 as well as P through 12, not all things are created equal. Poverty matters in terms of children's ability to effectively learn because of home environments, because of violence in their communities, because of hunger, because of health, unaddressed health issues, all those things. English language learners, special needs, extreme poverty, all of those things matter, and they need to be taken into consideration when we think about equitable funding and making sure that all kids have a level playing field. And so that is the goal and the aspiration that we need to keep in mind, again, for a P through 12 system. So we want to ensure that education funding for students is equitable and adequate. And again, I suspect that there'll be some specifics that fall under this as we move into the legislative session. As I said early on, in terms of the governor's speech, there was lots of good things about education, but at the end of the day, it comes down to the money. And so we, as you know, with you, have been talking about revenue for a really long time. And we don't seem to be getting any better at it. Our voices don't seem to be heard particularly well or effectively because we still have an inadequate and unsustainable revenue stream in terms of what we need to pay for in Illinois. We have a revenue system that doesn't really recognize who Illinois is today, both in terms of how we prosper, but also how we struggle. And so Illinois, we would say, Illinois tax policy is unfair and inadequate. We have a flat income tax rate. We are one of 7 states across the country that still has a flat tax. And it is insufficient, and it is, at the end of the day, actually not fair. A flat tax seems, on surface, well, everybody pays the same. That seems kind of fair. But it isn't that everybody pays the same. It's that everybody pays the same percentage. And 5% on a very poor family versus 5% on a multimillionaire ends up being a very, very different hit to your bottom line. And so it is not fair to have a flat tax. We should join the majority of states in this country and move to a progressive tax that really does increase as you increase your income. Excuse me. Income tax accounts for over 60% of our state's revenue. Income tax. It is not manufacturing tax. It is not the tax that you pay on your goods and services, because we hardly tax any in this state. It is the income tax. And so if we address our income tax system, the inequity and the low rate, again, we are also one of the lowest tax rates in the country in terms of our income tax for those states that have an income tax. And so we need to address both the level of taxation and the fairness. So even minor changes can significantly affect revenue, because we are a populous state. We have around 17 million people in the state, and unemployment is relatively low, and so there's lots of people out there working, and there's lots of people making lots of money. So if we move to progressive, we can actually really start to fund a system without too much pain on those already hurting. Revenue also needs to be sustainable. There are lots of proposals that have been put on the table over the last number of years by many of our partners. We are a member of the Responsible Budget Coalition that has done good work on this for many years, through a couple of governors now. The Fiscal Tax and Policy Center has done, Center for Tax, I'm sorry, I forgot their name. But the Fiscal Policy Center has done some good work. Voices for Illinois Children has done some good work in terms of, we're not telling the legislature what to do, but there are options. And so when they tell us that that there's nothing to be done, we have the documentation that shows, well, you're actually wrong. There's lots of things that can be done. We simply need the leadership to make the decision and to swallow the pill and to say, you know what, part of any solution has got to be to raise taxes, because that is the reality in Illinois. So we have to support sufficient and sustainable funding that's based on 4 principles, and these are principles that we abide by. These are principles that are jointly agreed upon by the Responsible Budget Coalition and a number of others. There are no harmful or inequitable cuts to vital programs. That we have to make sure that when we come up with adequate and sustainable revenue, it means that we are funding services across the board evenly based on the need and not based on just getting by. We're not going to rob Peter to pay Paul. We need adequate revenue to fund the state's priorities. We have a number of priorities that are articulated across state government for all types of services: education, human services, mental health, foster care. We have lots of visioning statements, but we have no revenue to support them. And so where are we going in this state? Fair graduated tax structures where individuals earning lower incomes pay lower taxes. That is fair, right? The poorer you are, the less tax you pay. The richer you are, the more tax you pay. Seems to make sense. And we need a balanced, responsible FY17 budget, and every budget thereafter needs to be responsible. We don't dig our hands in the sand to say that we've made good decisions as a state over the last number of years. We have kicked the can down the road, being the state of Illinois, the legislature, the number of past governors, but it's come to a head. And we really need to address it. And both the federal government has said so, the lending houses have said so in terms of how people want to lend us money and what that's going to cost us to borrow. So it is time for action. And finally, in terms of our priorities, child health and safety. So this year, under this category, last couple of years, we've worked on crib bumpers. as a safety issue. We're not going to be moving that legislation forward, but really feel it's time to retrench and to really build some grassroots support, some public education, and to really create some pressure around crib safety. Also under this, in terms of safety, is the work that we've done since the inception of this organization around licensing in terms of those health and safety guidelines that really do monitor where children are cared for in child care programs. And so a number of things fall under this general category, and so we are always looking to partner with collaborators, look for opportunities as to how do we strengthen health and safety for young children, but we are not proactively moving any legislation or initiatives forward this year under that category. So that kind of wraps up where we are in terms of our state policy priorities and kind of a preview of the session to come. I'm going to talk really briefly, and then we're going to open it up for questions, because we definitely want to hear any of your questions or concerns. I'm going to just touch really briefly on some federal legislation that has some immediate impact, but I'm going to tell you about a time in February where we're going to specifically spend some time to dig deeper into what's happening at the federal level, because there's a lot happening. And we realized that if we tried to cover that today, that we would clearly run out of time. So a couple of immediate issues that we wanted to alert you to is the child nutrition bill. This is the child and adult food program. Hopefully all of you on the phone rely on CACFP to help you provide healthy food and snacks to the children in your care. There is legislation to the child in the child nutrition bill that would provide an extra snack. This is something that we lost a number of years ago, and we're trying to get it back. So again, this is really a restoration. That it would provide providers the funding for children in early childhood to receive an extra snack in those programs that earn care for at least 9 hours. Now, what do we know about children's eating habits? They eat little things often as opposed to lots once. And so losing a snack for very young children is critical. We know that those children still need that snack, but we know that that snack is not coming out of a federal funding source anymore because of the change that happened a number of years ago. It's time to get that back. We have a focus in this country of healthy eating for children, particularly to avoid childhood obesity and to try and bring those high numbers down. And so this is a good step in the right direction, and so we support the bill that's out there that I will tell you is way watered down. It is not what we started to ask for at the federal level in terms of child nutrition. It is simply what we have ended up with, but it is, you know, an incremental step of improvement. There's also an FY16, a federal fiscal year 16 appropriations bill increased funding for Head Start and for the Child Care and Development Block Grant. So by Head Start, it was increased by $570 million, and for the block grant, $326. An increase is always a beautiful thing. Given the incredible need that exists, the underfunding that exists in the Child Care and Development Block Grant in terms of those monies that flow to states, of course, we would always like to see more, but we never want to sound piggish. But we do, of course, support the increase for Head Start and the Child Care and Development Block Grant. The appropriation bill was passed. You know, the feds never really do their budgets on time either. So, but they're allowed to do extensions, and we're supposed to not. So, but the appropriations bill was passed in December, and it was favorable because we saw these increases for Head Start and to child care. But we definitely, as I mentioned earlier, and what we'll talk about in a second, or actually we'll talk about later in February, is these new requirements and guidelines for the Child Care and Development Block Grant. And so we know that those increases or those changes are designed to improve care for children and families, but we also know that they're going to cost the state additional dollars. And so we need to see some of those dollars coming from the feds in addition to the general revenue investments that we make here at the state level. So again, just two things that we wanted to alert you to in terms of federal legislation, but we're not going to get into that because there's a lot, and so we wanted to carve out some specific time later in February after the president makes his his budget is released on February 9th. So we want to now, so I'm going to stop there and open it up for questions, comments, try and answer them as best I can. I don't have answers to everything, as anybody who knows me knows. But are there any questions? And you can type those in. And I'm trying to see them. Can you tell us when the child care assistance applications will be reviewed beyond? I don't understand this question. And I'm going to ask Maya if you could come in here and help for a second, because I can't see but more than one line of the question. I don't know how to make this box bigger. So, oh, there we go. Can you tell us when the child care assistance application will be reviewed beyond October? All right, we're not going to get into processing questions on this call. I really do apologize for Chicago providers or anywhere in the state who are experiencing delays in terms of applications for child care assistance. You know, applications from October have well been processed, so I'll just say that. And if there's still applications that you know of that are outstanding from October, chances are that there's a problem with that application and a communication has happened with the applicant. So, you know, we're behind, but we're not that behind. But I also am not going to be addressing kind of application delay, payment issues. This is a policy webinar, and I want to really stick to the policy questions. I would appreciate that. Again, I have no idea what Gateway's registry number that somebody typed in, and I can't. If you have issues with Gateways or you have questions about your professional development or hours, you probably need to call INCRA, who manages the Gateways system in terms of professional development for child care workers. This is not a clock hour training approved, so there is no clock hours for this. But if you have other questions around approved trainings, it is part of our robust professional development system in Illinois that we've been working to build over the last number of years. Again, I'm struggling a little bit with the questions that are coming in, because they're very specific and they're very focused on what your issue, your problem, your frustration might be right now. But I can't answer them because I don't run the Accelerate program. I don't decide what the different issues are. So if you could really think about the presentation, the overview that we've given, questions about the policy process, questions about our priorities. I can't be answering questions that are specific simply because I don't have the answer, so I apologize for that. But I really need the questions to be broad. If we don't have any, then we'll just move on to the upcoming events. In terms of the Child and Nutrition Food Act, in terms of the extra snack, that is a bill that is before Congress. I didn't say that would be happening, that is a proposal that's in Congress. I'm sorry if I wasn't clear about that. And it is something that we're advocating for. So hopefully you've gotten some of our alerts to mobilize you on calling your Congress people in terms of the proposal that's before Congress, because that is a federally funded program, that is not a state program. So great environment that we have in Illinois to be looking to increase federal dollars, because we are so underfunded at the state level. So anytime that we can maximize federal resources to children and families, that'd be great. The Child and Adult Food Program is available to both centers and homes. The legislation in front of Congress would address the Child Care and Adult Food Program for everybody. It doesn't change who's currently eligible. The states that have progressive taxes, I think Massachusetts has a progressive tax. I believe Iowa might have a progressive tax. Unfortunately, Samir's not in the office, and he's the better. It's been a while since I had that list in front of me. But, I mean, there are a number of states that don't have state income taxes, so they're part of the 7 that don't. Illinois is one of the 7 that doesn't. So I would say you know, if you threw an arrow at the map, chances are you've hit a state that has a progressive tax, since there's only, I think there's 4 states that don't have state income taxes. That means 3 have flat taxes. But we can get those to you and post them somewhere in terms of other states that everybody else has moved to a progressive tax. I'm sorry, I don't understand the early intervention question. Is there a plan for a workaround to enable therapists wanting to work in early intervention could not get enrolled currently due to the state's impact application process? I'm sorry, I don't know what the impact application process is, so we can look into that and try and respond to that, but unfortunately I can't answer that. This presentation will be available on our website, and it is also being recorded, and so that will also be available on our website. In terms of the child care assistance program, so child care was included in the bill that was passed by the legislature that allowed for child care to be, for the federal child care dollars to pass through. I should say that part of child care is also being paid for because of a court order that happened early on in the summer, right after the fiscal year began, that required state employees to be paid. Included in that court decree was anybody that is represented by collective bargaining with the state, and so the court interpreted that to say that family child care providers, because they're covered under a collective bargaining agreement through Service Employees International Union, are being paid. So family child care providers are actually being paid out of GRF. It is the centers and child care resource referral agencies that are being paid under federal dollars. I don't know if we're going to quote-unquote run out of money in terms of the federal dollars or the state dollars for that matter, because one, we don't have a budget, and so we're just kind of spending. It's kind of to say you had no idea what your budget is, so you just spend at will. I mean, it's a little bit like that, but I mean, we know how much revenue is coming in, and we still have a Department of Revenue. We simply don't have a budget that's guiding the spending, and so as bills come in, we're paying them. The other thing that I would say is that our eligibility changes, the eligibility changes that happened on July 1st had an incredible impact on the number of children that were actually enrolled in the child care assistance program. We dropped from about 176,000 kids to what we understand to be about 135,000 children. Those children won't come back on the system overnight. Unfortunately, we have received no data from the Department of Human Services since the November change that allowed for greater eligibility to 162%. So we don't know what our current caseload is. And so the question of are we going to run out of money is completely determined by the number of children in care. And because we have no idea how many children are in care, we can't really answer that question. We always knew that they wouldn't come back overnight, but we don't have any sense of how many of them have come back onto the system in regulated care with the change in eligibility. Again, because data that we used to get on a monthly basis and review with the Department of Human Services has no longer been made available to us, and so we're a little bit shooting in the dark, unfortunately. No, I made a reference to February 9th. The President will be announcing the federal budget on February 9th. The state budget will be released and announced in the State of the Budget Address on February 17th. I will get to those dates in just a minute. Let's see. I'm trying to think if there are any other questions. Oh, here we go. I think those are for the ones that I could answer. Again, I apologize for things that I cannot. There's a question, was there anything mentioned regarding early intervention? You mentioned several ideas regarding P through 12. The ideas that I mentioned for P through 12 were simply drawn from the governor's address. They were not, we were just kind of drawing on some of the references that he made to education and specifically early childhood education. They weren't necessarily our priorities. We were simply drawing from the governor's address. There was no specific mention made to any part of the early childhood system. They didn't specifically talk about child care or pre-K. He talked about early childhood in general. And so there was no reference made to early intervention. And so we consider, when we talk about the early childhood system, we think and talk about and include early intervention as a critical piece of that. But there was no specific mention in his speech of early intervention or 0 to 3, unfortunately. Who do we go to about Accelerate was a question. So it depends a little bit on where you live in the state, but I would say the best place to go to learn or to understand more about Accelerate is your local resource and referral agency. So every resource and referral agency has 3 kind of core functions. One is to process applications for the Child Care Assistance Program. One is to provide parent resources and referrals for parents looking for child care in their area. And the third, of course, is professional development and training of the child care workforce. And so, and through that department in each resource and referral, they are the ones who are really administering and supporting programs who are looking to move in the quality spectrum in terms of our Accelerate program. So I would start with your local resource and referral agency and going to their family resource or their provider resources department in terms of any questions specifically about Accelerate. You can also always call INCRA in Bloomington, the Illinois Network of Child Care Resource and Referral Agencies, because they really manage the kind of statewide data and also the Gateways system in terms of professional development. So you can always go to INCRA, if not to your local resource and referral agency. I hope that's helpful. I'm going to move on a little bit because I think I've gotten all the questions that I actually have the ability to answer. And I do want to just point you in the future to the upcoming events. February 4th, we will be doing this webinar, but in Spanish. So if you know of or would like to hear this again, but in Spanish, we will be doing this webinar in Spanish on February 4th. On February 9th, as I mentioned, so these are kind of state-focused events that are coming up, so let me start there. So on February 9th is just so you know, the Department of Human Services will be having a federally mandated public hearing on the state's recommendations around the implementation of the Child Care and Development Block Grant rules and reauthorization. And so those will be held in Bloomington, Illinois. You can go to our website and we can post the specific information about those. We'll also be sending out an alert about that as well. But February 9th, it's kind of like February 9th is the day where everything is happening. So you're going to see that date a couple of times, and we're not going crazy. There just happens to be a lot of things that are going on February 9th for some reason. February 10th, it's a momentous day because the House and the Senate are actually going to be in session. It's not happening a lot so far this year, so we wanted to mark that occasion to say that they will actually be in session and in Springfield. And then on February 16th, we will be doing, all right, this is kind of, so what we didn't say here was that on February 9th is also the President's budget address or budget release. He doesn't really do an address. He already did his State of the Union. And so on February 9th, the administration will release their final budget in terms of the last year of the Obama administration, and that will become public on February 9th for all of the states and all of the country to know where the funding priorities are and what the proposals are that the administration will be pushing for their final year in office. And so then on February 16th, we will be having a webinar that will focus specifically on that federal budget proposal along with other federal legislation and initiatives that impact early care and education, particularly at the state level. So February 9th is the DHS public hearing. It is also the President's budget release date. February 16th, we'll be having a webinar that focuses on federal priorities. And then on February 17th is the State of the Budget address by Governor Rauner. So at the state level, He does a separate State of the State and a State of the Budget. The State of the State was yesterday, and that talks more broadly about vision and priority. The State of the Budget is when he's going to talk about the money proposal. That will happen in Springfield at noon. It is telecast both through a NPR affiliate, but also you can go to the ILGA website and watch or listen to it live, or you can go to Springfield and see it up close. So that'll happen on February 17th. And then on February 24th, we're going to do a second webinar. This one is broad and visionary in terms of our priorities going into the session. On the 24th of February, we're going to dig down into what the governor said in his budget address and to really start to talk about the money. And then on March 1st, the Illinois State Plan for the reauthorization for the Child Care and Development Block Grant reauthorization is due to the federal government on March 1st. And so that is when they solidified to tell the feds, this is how we're going to implement the rules that you have given us. And so that has to be submitted to the Federal Department of Health and Human Services by March 1st. And then March 8th and 9th, a little earlier than our usual Spring into Action conference, but that is when we will be gathering in Springfield with hopefully all of you and many more for our 2-day advocacy and policy conference. We're excited about that. There is information on our website, and you should have already gotten and will continue to get email reminders or alert or reminders about that event. So finally, in the last, on the last slide, we have, if you want more information, the places where you can go. Again, this will be posted on our website. We will try and also include in the PowerPoint the information about other states that have progressive taxes, or the easier way might be to tell you who doesn't, because then you can know that everybody else does. And of course, then you can always email us with any specific policy or advocacy questions. We always want to be helpful and available to you to improve your ability to advocate for children and families. And I think that's it. So we will hopefully, for some of you, on February 4th for the Spanish-speaking webinar of this same presentation, but if not then definitely on the 16th, sorry, the 16th of February, when we will be digging down deep into the President's budget proposal. So thank you all again for calling in, and we hope this was helpful for you, and we will see and talk to you soon. Bye-bye.